We just had a person here that said, I have the same number of minutes left in my day regardless, and I just want to make sure I optimize those minutes. And optimizing to me is spending time with patients. So I think AI can be definitely a part along for the ride and actually help them care for patients better.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As builders and operators, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the Flava of the week about the CMS Health Tech Ecosystem's first wave event. How significant was it to see demos from more than 50 companies that are making good on their pledge to create a fully digital, patient-centered health system? And what's your part in helping consumers understand and trust what's possible now? I'll talk about that. Then Ron Books, CEO of NetHealth, talks about how he believes that AI is the only thing that can save the human element in healthcare, examples from the wound care and rehab therapy space, and then a fun one for me as we talk about Arizona becoming a health tech hub. I'm Jared Johnson. Let's get it. Flava of the week. The first wave of tools from the CMS Health Tech ecosystem rolled out last week, showing the foundations of a fully digital, patient-centered health system. The live-streamed event was held April 9th and showcased an MVP of basic use cases demonstrated with real data exchange. CMS highlighted tools from more than 50 companies, many of which are already accessible or will be available to the public soon. These efforts represent the first real-world implementation of a connected digital health ecosystem where patients can access, share, and use their health information through trusted applications. As part of the event, interoperable digital tools were introduced intended to streamline care and improve the patient experience. Highlights included digital data access and check-in, aka kill the clipboard, allowing patients to securely share information with a simple scan on their phone, and personalized health applications offering tailored guidance on nutrition, wellness, and chronic disease management, extending care beyond clinical walls. CMS also announced a go-live for the full ecosystem framework on July 4th, yes, on our country's 250th birthday, which will include FHIR APIs, record locator, and FHIR subscriptions for patients, providers, and value-based care organizations. What's the consumer lens? This is the future and it's coming fast. What's more, the excitement behind the progress is palpable and real. It was evident at CES, Vive, HIMSS, and other conferences this year by walking the show floor and attending sessions. So there's a lot of momentum on the inside. What's interesting is how that momentum will quickly shift outward and be put in the hands of consumers themselves. And that's where the success of the ecosystem will be determined. Because what's the promise of a world with consumer-centric healthcare experiences, more people engaging in their health, happier clinicians, better access to quality care, lower costs of treating chronic conditions, and ultimately a healthier society. The promise is there, and by all accounts, it appears we're making greater progress in the last 8 months than in decades previously. But consumers are savvy and skeptical due to scar tissue built up from poor experiences. Healthcare hasn't always lived up to its promise in the past. Plus, there are legions of online voices, either intentionally or unintentionally, eroding trust in the traditional system even further. So I believe there's never been a greater need to show patients what's possible now and do it in a way that they can overcome those previous negative experiences. It's one thing for the industry to believe and value what can be done now. It's a whole other thing for consumers to feel the same way. We'll keep doing our part here on this platform, and we hope you'll be a part of the solution too, so we can look back and say we helped grow adoption of what healthcare was always meant to be. Let's be intentional about how we can each help consumers understand new options for their care as the CMS Health Tech ecosystem and other initiatives make remarkable progress at a rapid pace. That's another way that we'll build the healthcare of tomorrow. And that's the Flava of the week. The flow. All right, let's get to the flow. A bit of a unique thing. We've been fortunate lately to have a couple of other guests from Arizona, so I'm never sad when I have an opportunity to speak with a fellow Arizona healthcare innovator here. But Ron Books, the CEO of Net Health, is here to join us today. Ron, welcome to the show.
Thank you so much, Jared. Happy to be here.
So give our audience a little bit of an idea of what that means in terms of, you're locally based here in Arizona, but maybe a little bit more about Net Health and who you are and what you do.
Yeah, I'll start with me. Like you said, I'm currently the CEO of Net Health, but a little bit of background is I've been a SaaS software CEO for the last 18 years. I was previously at a company called ECI Solutions, which is essentially an ERP and business application software provider focused, once again, specialized software, which you'll hear a common theme among my background, but focused on SMB clients in specific vertical markets, including lumber and building materials, retail hardware stores, residential home construction builders, small manufacturers. So really a bunch of SMBs across the world. And I was there for the first dollar of revenue, and now it's approaching about 700 million in revenue and over 25,000 clients. So it was quite a run. I ended up exiting the business, the day-to-day, in 2021. I'm still on the board of directors, so still involved in the business, but I stepped away. And then later that year, ended up joining the Carlyle Group, where I served as an operating partner and on a number of their boards. I served on a board in a company called Abrigo, which is fintech software. Served on a board called HireView, which is HR software. And then I also served on a board of Net Health, which is focused in the healthcare space. So I was there for about a year. They were looking to make a change at a CEO. They asked me to step in August of 2023. So I'm about 2.5 years into the healthcare space. So I'm not a veteran like yourself, but truly love it. It really is fascinating how you develop technology that can impact the patients and ultimately their health outcomes. So Net Health, just to give you a little bit of background there, it's a technology provider, once again, primarily serving two markets, which is rehab therapy and the wound care space. So our software is purpose-built for those specific markets around all care settings, from hospital to SNFs to senior living facilities to private practice. And now with our most recent acquisition of Limber Health in June of 2025, we extend into the home with remote therapeutic monitoring and home exercise programs. So big about focus of carrying the client across the care continuum. And it's been a great ride so far.
I'll tell you what, any top of mind observations from this journey of your background and then coming into healthcare with insights from other spaces? Is there anything top of mind that stands out?
Yeah, it's interesting is that when you come into the space, two things I would say is the people that are at our company right now, a lot of them have been former therapists or clinicians, so they're technology providers, but they actually have worked in these offices or for the clients we're actually trying to serve. So that's a little bit unique. But secondarily, I think the fascinating part about healthcare is, don't get me wrong, there's noble causes in other vertical markets that you're serving and you're trying to make them better. But here, if you actually do your job well and the software helps the clinicians, which ultimately help the patients, I mean, you're literally having an impact on somebody's care in their life. And I think that part's unique. And what I found is with our people at our company, with their backgrounds, that's what they're focused on. It's developing software, but it's ultimately taking care of the patient.
Almost everyone in the industry would agree with that, the nobleness of the space here. So true. I wanted to dive into a couple of things that I think are themes or just definitely strong perspectives from your experience. One of those main ones is something that you've said that AI is the only thing that can save the human element in healthcare. I would love to hear more about that. I would love to hear what are we not understanding or kind of what are we getting wrong about that in other places where that could be the case.
I'm absolutely a realist about AI. I understand that I'm a technology CEO across multiple vertical markets, and I can understand it's going to transform many work environments. And in some of those situations, it will displace some of the workers. I'm a realist, and that's going to take place. I think the fascinating thing about the healthcare space, especially where clinicians are constantly focused on servicing patients better, that I think AI can be more supplemental and more helpful versus a replacement tool. So at the end of the day, and this is what our clinicians are telling us, they're very open to adopting AI. Some people are scared across different markets of, okay, what's it going to mean to me? I think the clinicians in this space, the conversations we're having with our clients is they're very open to adopting AI. They want to look for ways where AI can help them care for some of the mundane tasks like documentation or pre-authorizations or billing or revenue cycle management. If the tools can help them in those spaces, they can do what they've self-described as, okay, let me focus on the high value work, which is spending time with my patients. So we just had a person here that said, she was very forcefully, she said, I have the same number of minutes left in my day regardless. And I just want to make sure I optimize those minutes. And optimizing to me is spending time with patients. So I think AI can be definitely a part along for the ride and actually help them care for patients better.
When people say they worry about AI will just put more distance between them and the patients, you're saying, not if we do this right. Human first AI.
Yeah, healthcare is human tech. Yeah, health tech is human tech. That's exactly what the concept is. And I think it's going to, I'll give you an example is that if you just look at what's happening, and I'm sure you're super familiar with this, but with ambient documentation or listening tools, it's a great example of it is we built this. We started by looking at this and said, we have to solve for this in our EHRs. And we started looking at partnerships or third parties that we can integrate to. And we quickly found, Jared, that we needed to embed these solutions into the overall workflow. So the tool now listens, as you're probably familiar, but for others, it listens to the patient clinician conversation. It combines that with the existing client history in the EHR, and it starts to populate or document the fields or forms that historically this was being done by the clinician. They were literally speaking into a therapist, maybe speaking into a voice recorder, or it could be taking notes rapidly while they're trying to serve or provide therapy. So now that what it does is it takes that conversation. The interesting thing with AI is it will listen to the conversation. If they go on a tangent and start talking about a vacation they took or what they had for lunch, it's going to ignore that part and it's going to take the relevant information. And it's going to populate the relevant fields. And this, once again, will make things more accurate. It saves time for the clinician, but even more directly, and this sort of was feedback in our beta process, is that the clinician said that they felt more connected to the patient because they had their undivided attention. So once again, how can we leverage AI in health or technology in general to allow them to focus more on the client and improve their overall experience? So I think that's where the part that I think you'll find that we combine technology with the clinician so that we get the best opportunity for care.
So how does that look for the patient? Do they feel the same way that the doctor's giving them more attention?
100%. It's like think of a conversation where somebody, like we all have it. Like I take notes on some of my calls and I feel like sometimes as I'm taking notes and I'm trying to listen, I'm doing the exact same thing. I'm looking on my screen, I'm typing notes. They're taking notes rapidly. They're speaking into some sort of voice recorder. If they're staring at the patient and they're totally focused on that patient and they're having that conversation and watching them as they're performing their therapy or whatever it may be, the connection is 100% there, and it's more intense than it was if they're trying to rapidly write stuff down or document items.
That's been the promise of ambient listening all these years. So to hear that it's actually happening is at scale.
Yeah, straight from clinicians too, which is the part that, like at the end of the day, if we're not making them feel like they're doing a better job and ultimately the patients, it's meaningless, but they're saying this is what helps them, and they're giving us feedback about the increased connection, which I thought was quite fascinating.
Yeah, let me dive into specialty care here for a moment, because my limited understanding is that specialty care is dealing with a pretty substantial data overload right now, safe to say. So how is AI helping that? Like, where is it making an impact for clinicians?
I'll talk about AI, and I think that, well, you're right. There's a challenge, and we're part of I would say Net Health, we're an EHR provider, we're part of the challenge. What the challenge is, there's so much information being thrown at these clinicians from so many different areas, and their job is to synthesize all this information and make sure they can ultimately have a 360-degree, full look at the client in any historical stuff or what their care has been. And then I think you'll see it in AI, some areas like documentation, which is going to improve this, because the ability to synthesize data and make sure that it's not redundant is going to be important. But secondarily, and I'll even go away from AI for a second, I think what you're seeing more of, and it's happening already, I just think that it still has a little bit of ways to go, is a big part of it is interoperability. So the ability for all of our systems, and I'll give you a very specific example, is you have the more general solutions or the large HISs, the Meditechs, the Epics, the Cerners. And then you also have people like PCC and Matrix Care. We're working with them specifically in these areas, and we have to have connectivity. We have it right now, But if we can improve that connectivity and share information back and forth amongst disparate systems, which is difficult because we're running different businesses, it's different languages, and we don't have direct access to each other's systems. We have to allow certain level of access. It's going to improve interoperability, which will ultimately, once again, synthesize the data for the clinician. So I think there's progress there. I think there's still a ways to go, but I think a combination of AI and greater interoperability is going to improve the overall client experience.
That's the direction I think makes everyone happy. I mean, that's where we all want. I don't know. It's probably safe to say people don't want to have a poor experience. People don't want to create a poor experience. And so at the same time, we know like the amount of data is not going away, and the ways that we are able to get the right insights out of it at the right times in that workflow. I mean, yeah, like which quest are we on right now? And it's prioritizing that over other ones in the middle of cutting costs and growing and everything else going on and understanding policy. And I feel for clinicians. I feel for those building the system. I feel for the tech providers who are supporting them. And I think that's important for us to not just be one-sided in this equation, because it's the tech plus the clinician plus the
Couldn't agree more with you. Yeah.
I do want to make sure we hit this because I'm excited about this thought of Arizona. I don't think it's self-serving. I think it's actually a really cool story to tell. I mean, there are some really cool things happening in this area of the country that I rarely hear about outside of our state, to be fair. So for those who are not local and listening to this, a lot of cool things are happening in Arizona. This is starting to become a health tech hub. Okay, first off, do you agree with that? Are you seeing that? And if so, what do you think's driving it?
I can give very specific examples in the healthcare space, but even outside of the healthcare space, I see a lot of businesses that are their corporate office is in Arizona. And I think there's a number of reasons. I think the part you and I will share completely is it's a great place. It has great cities. It's beautiful. It's sunny all the time. Yeah, there's a lot of great things, I think, just about the area that will attract people. So I think that's a big factor. But secondarily, if you really look towards the business aspect of it, from a business perspective, it's pro-business environment. From a regulatory and tax perspective, that you have a number of colleges that can be a feeding ground for employees. ASU right here. I think Arizona is even when I talk to other people, it's almost like you get the benefits and the beauty of California without some of the increased regulations or tax perspectives that come along with that. So at Net Health, we are 100% remote, so we can pretty much go anywhere. I landed here because I love the place to be, but we are remote. And ever since COVID, especially in the tech world, I've seen it really across all the businesses I work with, is you have to offer some level of flexibility or remote capabilities if you want to attract and retain talent. So we have it almost like 100%. We have a corporate office in Pittsburgh. We have 100%, almost 100% remote. But I do see, I'm sure you know them, No2's here, WebPT's here, just in the healthcare space. So yeah, I see a lot of people moving here, and I think it's an attractive place, and I think it's pro-business for sure.
There's more momentum than there's been in years past. I think is easy to say there. And you pointed, WebPT, No2, right? ASU Health coming online there. That's exciting. So for those who aren't familiar there, ASU Health was just recently announced in the last 2 years as not just a medical school, but part of their pretty innovative vision for med tech and medical training and clinical training all kind of coming together. It's pretty remarkable, I think. So yeah. I mean, why not? Why not share some of that?
All the great things. And the last thing is, for many of us who travel a lot, and I know it's West Coast and it takes a while to get to the East Coast, but for the most part, Arizona, like Phoenix area, you can fly direct anywhere. And that becomes important in business too. You want to make sure that you have connections everywhere, and you're seeing clients all over the country and all over the world. So yeah, I think it's going to continue to build up. It's a great place to be.
What can you tell us about where Net Health is focusing in the near future, next 6 to 12 months? What's kind of on the radar screen that you can share with us?
I spent a bunch of time on AI, but I'll introduce another aspect of AI. I think that in general, we're all everybody's trying to figure it out. Like, how much is it going to impact our businesses? Where do you want to leverage it? It's a balance for sure. But it's not just from an external perspective. Obviously, you want to leverage AI to produce products that can help your client base. But everybody's looking at AI too internally. Is like, where can we leverage it internally that makes us a better business, or we can produce more work and increase productivity? So I think there's a lot of that, and you'll see that in pretty much every business over the next 6 to 12 months. For Net Health specifically, we are in the midst of, we have a number of new products coming out, talked about AI listening, but we also have in our SNF in senior living space, which we have a very strong position there. We were launching last year too. It's been building up for a couple of years, a new web product, EHR web product that is once again AI friendly. And we've been rolling that out over the last 6 months. We'll roll that out through the end of this year. So it's a big initiative for us, super exciting. And we'll once again help the providers, which then in turn can help their patients. And then the last area, I have to mention this, and I know you and I talked briefly, is we have our next client conference in the next month, which is once again in Phoenix, Arizona. So hopefully you will be able to stop by and see us. But yeah, we love that. We've had it the last 2 years. This will be our third one. It's a place where we get together. Net Health employees are in attendance, several of our technology providers. We have a keynote speaker in Dr. David Rue, from AI expert from Microsoft. And most importantly, we have a bunch, 200 clients that will descend onto Phoenix and share opportunities and talk about the priorities and make sure that we are moving in the right direction from a Net Health perspective, and then talk to them about real life scenarios to make sure our prioritization meets their needs. So we do have that coming up. Yeah, exciting. Hopefully you'll get an opportunity to stop by and see us.
Great venue, great time of year for sure for that. So yeah, I am. I'm looking forward to that. Ron, I love just being able to give a glimpse for those who are listening and watching into just your world, but also why it matters. And to that end, and kind of wrap our conversation today by asking you, what's one thing when we're talking about specialty care providers, what's one thing specialty care providers can do to make healthcare more patient-centered? Recognizing that doesn't mean it's not clinician-centered anymore. It's often both. But what's one step that a specialty care provider can take to be further down that path?
There's so many steps, but I'll give you one thing. I think that what made the biggest impact for us over the last year, and us being able to help the clinicians and therefore the patients, is just listening more. Like client feedback, and I plugged Next a little bit, but I truly mean it. We have our product advisory boards there. We have customer advisory boards throughout the year. And it's an opportunity for our clients who are out there directly interacting with the patients to give us feedback on what we can improve to be better and to service them better. So I think as we continue to take that feedback, because they're on the front lines, and then we incorporate that feedback into our specialty software, I think that's where you really start to improve both the clinician experience, but ultimately, which everybody's trying to improve, which is the patient experience. So we'll continue to listen. I feel like we've made great progress there. And yeah, I'm looking forward to what happens in 2026 and beyond. Great
place to wrap it up. And yeah, I agree. As we're looking to improve the patient experience, there are all these steps that take place. Several of the tools you even just mentioned here are parts of that process. They don't single-handedly solve everything, and all of a sudden now everything is smoothed out with the patient experience. This is a transformation with a capital T, and it's ongoing and it's accelerating, but it's still a journey and it's a process. So thank you for pointing that out. And just want to thank you for everything you're doing to make healthcare more consumer-centered. I look forward to keeping in touch. And thanks for joining us today, Ron.
No, 100%. Thanks, Jared, for having me. We enjoyed it.